Occupational English Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1.
Extract 1. Questions 1 to 12. You will hear a physiotherapist talking to Kelly, a woman with lower back pain. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
All right. Hi there, Kelly. My name is Erica and I'm one of the physiotherapists here.
Hi, Erica.
How can I help you today?
I've been getting a pain in my lower back on the left side, around my hip and through the bum cheek area, when I'm running especially.
Okay, that's not sounding terribly comfortable at all. How long has this been going on for?
It's something I've had on and off for years, and it started off as just a kind of dull pain. A bit of an ache, and now it really feels like it's spasming or something. It hurts even when I put weight on my left leg. Usually I feel it start, and if I kind of lie on a tennis ball and massage through the muscle, it goes away. But lately it's just been getting worse, and I can feel it sort of tight through my whole hip area. And I can feel it kind of even when I'm sitting and sleeping, or at night when I'm trying to sleep. If I roll, I can feel it kind of... It's hard to explain. It's like a shooting pain that travels down my leg.
Okay, so you described the pain initially as a dull pain.
Yeah.
And also an aching sort of a sensation.
Yep.
Is the shooting pain different to that?
Yep.
Okay, so the shooting pain, where does that go?
It starts in the same place, and it goes like down the back of my leg, kind of through the back of my knee, and sometimes down to my ankle area.
Okay, no worries at all. And that would be the shooting pain only? That's not an aching sensation?
No, it's just like, it feels like a twinge travelling down.
All right, so just coming back to our body chart for a second. So we've talked about 2 distinct pains, I think. There's that dull aching pain sort of around the bum and the lower back and the hip area there. Then there's that shooting pain or twinging pain that you get that goes right down the back of the left leg down to the calf.
Yep.
With the twinging pain, do you have to have the dull pain in your bum before you get the twinging pain?
Yep.
You have to have that pain first. Okay. Can you ever get the twinging pain by itself?
No.
No. Okay. Can you get the dull pain by itself?
Yeah.
Yes. Okay. So you have to have one to get 2.
Yeah, I don't always get the twinging pain. That's usually when it's feeling worse. It gets really tight.
Okay, no worries at all. Now, just to confirm and clear some other areas, there's no current problems with your left knee?
Nope.
Beautiful. And currently the front of the left hip is fine?
Yeah, it feels quite tight through there, but it's not painful.
So tightness?
Yep.
No worries at all. Any pains in the right hip?
Nope.
No. The right knee?
No, the right side's fine.
Completely fine.
Yeah.
Good. No pains at all down there?
No.
Any pins and needles or numbness anywhere?
Nope.
No. Good.
Extract 2, questions 13 to 24. You will hear a local GP talking to a patient called Paul John. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Paul. How are you doing today?
Oh, hello, Doctor.
Well, I see that you've just had heart surgery for a repair of an aortic aneurysm and now have a mechanical heart valve in place.
Yes, my surgeon advised me that I set up contact with a local GP for follow-up care, so here I am.
Yes, your thoracic surgeon, Dr. Goodhands, has forwarded me your case history, but it appears you've made a very good recovery.
Well, I hope so.
Now, before we talk more about managing your recovery, I'd like to get a few personal details from you, if you don't mind.
Okay.
So, how old are you?
32.
And where are you from?
I'm from China.
Okay. And are you married?
No, I'm single.
And where are you living now? House or apartment?
I'm sharing a house with some other students.
Okay. And what are you studying?
I'm doing a PhD in IT.
So you're quite busy here in Australia?
Yeah, that's right.
And how is your study going?
Okay, I'm enjoying it, but it's pretty intense.
So a bit of a stress involved with your study?
Yes.
I see. Now a bit of information about your medical history.
Okay.
Do you suffer from any allergies?
No.
Any past surgical history?
I had my tonsils removed as a boy.
And apart from that?
No.
How about your blood pressure?
It's been high since 2009.
Is there any family history of illness?
Well, my father died of a stroke when he was 45.
I see. Do you drink?
Not much. Sometimes on the weekends.
What about smoking?
Not now, but I used to smoke about 10 to 15 cigarettes a day.
And what's your current weight?
95 kgs.
And your height?
I think I'm about 178 centimetres.
When was your operation exactly?
2 weeks ago, the 2nd of September actually.
Okay, let me check your blood pressure. Good news. It's 110 over 70.
Oh, good.
Pretty soon we'll be able to start weaning you off some of the blood pressure lowering medication.
Well, that'll be good.
And how is your diet at the moment? Are you being careful with what you eat?
Yes, I've managed to reduce salt in my diet and I'm trying to lose some weight.
Good. And are you doing any exercise?
No, I'm afraid to do anything too much at the moment.
Okay, I understand. But you could now start with some gentle walking or other forms of mild exercise. Just be sure you don't lift heavy weights.
Right.
And there is a very good cardiac exercise program that I advise you to join. It's run by the Cardiac Rehabilitation Unit at the Spirit Hospital. So I'd recommend you contact them.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer, A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at question 25. You hear two doctors discussing the topic of keeping the immune system under control. Now read the question.
Doctor, could keeping our immune system under control be as easy as managing our diet?
Well, for instance, the immune cells involved in multiple sclerosis mainly depend on sugar to activate the disease. However, the common drug for multiple sclerosis, dimethyl fumarate, blocks this energy pathway. Contrarily, these energy pathways are feasible targets to treat certain diseases that might extend to dietary measures. I'd like to be extremely cautious about this because nowadays diseases and diets have become very common. However, the theory that energy metabolism is crucial in the way the immune system reacts suggests that there are possibilities that different kinds of diets are going to have impact on our immune system that we're just starting to understand but are yet to understand it completely. I wonder at some stage if the autoimmune diseases like multiple sclerosis may include diet as part of the disease management strategy, as well as other diseases where immune system and energy metabolism are essential, such as cancer.
Question 26. You hear physicians discussing the topic of coping with a peanut allergy. Now read the question.
Hello, doctor. What should parents do as peanuts have become an allergic substance nowadays?
It is really a very frightening factor to know that peanuts can cause allergic reactions, with increasing reports of sudden death in children following peanut ingestion, and new products are being launched on the market to help parents stave off a peanut allergy in their children. What I feel is feeding peanuts to children doesn't require any specialized products. Right now, we have the strongest evidence that kids are at high risk because they have a severe egg allergy or eczema, and the dietary guidelines suggest that infants with severe egg allergies or eczema should intake peanuts as early as their 6th month. What I feel is introducing peanuts to infants with moderate or mild eczema or egg allergies in a developmentally and culturally appropriate method would probably help prevent peanut allergies for the rest of their lifetime. Since peanut allergies are increasing rapidly, the early feeding strategy is something that the parents should consult with their pediatrician, as it is one of the best sources of protein.
Question 27. You hear the discussion between physicians on the importance of food challenge. Now read the question.
Hello, doctor. Why are food challenges necessary?
Following the recent death of a 3-year-old child that had a food challenge test, a new study of over 6,000 food challenges done found the safety profile very reassuring. Food challenge tests are the mainstay of food allergy diagnosis because other diagnosis procedures are not that precise. We have blood tests and skin tests for food allergies, which carry a lot of false positives. Therefore, in many instances, we do have to perform a food challenge test when the diagnosis becomes doubtful. There are a number of people walking around with diagnosis of food allergies who are actually not allergic to that food.
Question 28. You hear a discussion between doctors about fake Stop the Bleed kits. Now read the question.
Doctor, how do we get rid of the imitators of Stop the Bleed kits?
Stop the Bleed is a national campaign to increase awareness and provide training and kits to help the people witnessing traumatic bleeding. However, we must be very careful when obtaining the kit for our locality. The genuine kits are really very expensive, that may cost from $50 to $100 depending on the contents. However, there are some counterfeit tourniquets which are knockoff products. I would warn everyone that a tourniquet is meant for controlling acute arterial hemorrhage, will cost about $25 to $35. Therefore, if you're getting them for a lesser amount, you probably won't get the best one.
Question 29. You hear a physician explaining to his nurse about causes of obesity. Now, read the question.
Doctor, could the bacteria in our guts impact the development of obesity?
We often see children eating the same diet and living in the same environment differ in their weight. I feel that there's an interaction between genes and the bacteria in our guts that may be the culprit. The findings suggest that it isn't just the components of the diet, but it's the interaction between the diet we eat, our genes, and our bacteria in our body. Every kind of different diet would cause obesity in an individual who is predisposed to becoming obese. Certain genes colonized with bacteria that are efficient enough to produce more nutrients for the individual, resulting in obesity.
Question 30. You hear a physician briefing staff about the herpes virus infection. Now read the question.
Typically, the herpes virus infect the genital or oral mucosa. They affect the mouth, causing cold sores or blisters that form on the mouth, lips, or gums. There may be a prodrome prior to the blister development, with a burning, tingling, or itching sensation in the infected. Throughout the lifetime, the virus remains dormant in the nervous system, hence the cold sores which often reoccur in the same part. When it infects genital parts, it is called a sexually transmitted infection. The symptoms are similar to the oral infection of the virus. With the first outbreak, an individual may experience nonspecific flu-like symptoms like swollen lymph nodes, muscle aches, and a headache. There's also a possibility of having the infection without any signs or symptoms.
That is the end of Part B. Now look at Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fit best according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, questions 31 to 36. You hear the lecture given by a senior physician to junior doctors on risk factors of osteoporosis disease. You have 90 seconds to read questions 31 to 36.
Osteoporosis increases danger of broken bones. Hi guys, today I'm going to explain to you about osteoporosis disease, which makes the bones weak and break easily. According to a finding, binge drinking may increase the chance of getting osteoporosis in later life. The findings show that drinking too much alcohol over a short duration may impact genes involved in bone formation. Binge drinking occurs when a female has at least 4 alcoholic drinks in a hurry. However, for males, binge drinking occurs when he has 5 drinks in a short duration. America's Substance Abuse and Mental Health Services Administration indicates that binge drinking begins normally when a person is about 13 years old. Research involving adolescent laboratory rats was carried out to study the effects of binge drinking on their genes. They injected alcohol into the rats that resulted in a blood alcohol level of 0.28. In many American states, legally, a person is considered drunk when the alcohol level in the blood reaches 0.08. Some rats were injected with alcohol once a day for 3 days. The alcohol affected 300 bone-related genes in those rats. The other rats were injected with alcohol daily, but the injections continued for 4 weeks. In such cases, 180 genes were affected. The injections included ribonucleic acid to the genes of some rats, while the other rats, the RNA in the genes, decreased. Ribonucleic acid instructs the gene how to make proteins, the substances needed for bones and other tissues. Therefore, the change impeded with the molecular pathway that is accountable for bone construction. One of the most agonizing findings came 30 days after discontinuing the injections. That time, the rats yet showed differences in the way their genes were expressed. 30 days of a rat's life are equivalent to 3 human years. It is not essentially correct that what happens to the genes of rats will happen to human genes, but the findings suggest that binge drinking of alcohol by young people could indicate problems in their future. Bones are living tissue that continually break down and then rebuild themselves. However, as people grow older, the breakdown of bone is more than the reconstructed bones. As a result of this phenomena, small spaces inside the bone get larger, making it hollow, and the bone shell gets thinner. The term osteoporosis means porous bones or weak bones. By removing calcium and other essential minerals from tissue, osteoporosis harms bones. 8 of every 10 osteoporosis patients are females, and it is very common in Caucasian females over 50 years. Before developing osteoporosis, the patients experience a condition called osteopenia. Timely treatment can prevent this condition from developing osteoporosis. Osteoporosis and osteopenia can be detected by measuring the mineral density of the bones of the patient. Here, density means the strength of the bones. There are a number of ways to measure bone mineral density. The hip, spine, or backbone is used to examine the bone mineral density. A diagnosis called dual energy X-ray absorptiometry is the best method to diagnose osteoporosis that involves the use of X-ray radiation that lasts only a few minutes. Peripheral bone mineral density test is another method to measure bone density that is often used in the U.S. to examine if the patients are at risk of osteoporosis. This test costs less than the dual energy X-ray absorptiometry test. However, peripheral testing measures only one part of the body, and it is usually the heel, the wrist, or the bones between the finger joints. However, a shortfall of this test is when the patient has normal bones in the tested areas and has defective bones in other parts of his body. Then it cannot detect the disease. Therefore, often the peripheral test can show normal results of the patient who has osteoporosis in their backbone or hips.
Initially, the disease decreases the mineral density in the spine bone.
The mineral density of the bones of all parts of a woman is almost similar when she reaches 70 years of age. In such cases, the bone mineral density diagnosis of lower cost may not have precise results. Individuals over 50 years of age should intake 1,200 milligrams of calcium per day and 800 to 1,000 international units of vitamin D. Vitamin D2 as well as vitamin D3 are good for bones. Milk and milk products, fish with soft bones like salmon and dark green leafy vegetables, Orange juice, bread, and cereals are rich in calcium. However, one should be very cautious about the intake of calcium. It should not exceed 2,500 milligrams a day, including calcium from foods and all other sources. Too much calcium can result in kidney stone disease. Vitamin D absorbs calcium. There are many drugs to treat osteoporosis, of which bisphosphonates are the most popular. Fosamax, Actonel, and Boniva are products of this group of drugs.
Now, look at Extract 2, questions 37 to 42. You hear the brief instruction given by a physician to his staff on the abnormalities in thyroid functioning. You have 90 seconds to read questions 37 to 42.
Thyroid function. The thyroid is a tiny gland in the lower front part of our neck that is responsible for regulation of many of the body's processes, such as energy generation, metabolism, and mood swing. The two hormones secreted by the thyroid gland are thyroxine and triiodothyronine. If the thyroid gland does not secrete enough hormones, one may experience symptoms like lack of energy, weight gain, and depression, which is called hypothyroidism. However, in case the thyroid gland secretes too many hormones, one may experience weight loss, increased anxiety, tremors, and a sense of being on a high. This is called hyperthyroidism. Hypothyroidism. This is a condition which is classified by a decline in the thyroid hormones in the blood. It majorly occurs if the patient is suffering from underactive thyroid or glands that control the thyroid functions, though there are other various factors that can result in this condition. Typically, hypothyroidism affects females more than males and worsens as they age. Let me now explain to you the common causes that could result in a decline of this hormone, giving rise to hypothyroidism. The Hashimoto's disease is an autoimmune disease that attacks the tissues of the thyroid gland. Often, females suffer from this particular autoimmune disorder more than males. That can possibly be due to an underlying genetic link. The thyroiditis is such a condition where the thyroid gland remains inflamed, resulting in less secretion of thyroid hormone. Often this condition affects pregnant women, and usually this phase is followed by a hyperthyroid phase that remains up to 6 months. The radioactive treatment for hyperthyroidism can always lead to an unpleasant outcome, underactive thyroid or hypothyroidism. The possible reason is that the therapy might have considerably eroded the gland to secrete enough hormone for an optimal functioning. Usually, following a radioactive treatment, the thyroid gland always becomes underproductive for a few months. However, if the gland completely stops functioning, then the condition can be identified as hypothyroidism. The malfunctioning of the other glands can also result in hypothyroidism. For instance, a malfunctioning hypothalamus or pituitary gland can result in hypothyroidism. At times, certain medications taken to treat hyperthyroidism can also result in hypothyroidism. Often a diet that is low in iodine becomes a major cause of hypothyroidism in adults. Significantly, the regions with poor iodine resources can have a greater number of hypothyroidism patients. Hyperthyroidism. In the hyperthyroidism condition, the thyroid gland becomes overactive and secretes abundant hormones in the blood. The Graves' disease is a common cause for hyperthyroidism. In the disease, the immune system is supposed to release antibodies that mimic the thyroid-stimulating hormone and secretes abundant hormones that are released into the bloodstream. The nodules in the gland, as we age, lumps are developed in this gland that are non-functional or inactive. However, in some instances, these lumps start functioning on their own, secreting more hormone without the support of the pituitary gland. Certain medications taken to treat hypothyroidism can also result in hyperthyroidism. Thyroid enlargement is also a condition of hyperthyroidism that occurs due to any structural changes in the gland. The enlargement of thyroid gland is called goiter that can be unnoticeable as well.
That is the end of Part C. You now have 2 minutes to check your answers.